Hi, it's Rob. So for years, I've done a blog called Knowing Your Jargon. You can find it on Blogspot, Knowing Your Jargon. Under the pen name of ECT for Health, Knowing Your Jargon. But I thought I might turn it into a video series. So we're going to go through the alphabet. And each episode's going to be a letter of the alphabet. I'll cover 5 terms that start with that letter of the alphabet. And of course, today we start with A. So let's have a look at the first word. Atelectasis. It's been a bit topical in the TikTok lately. So atelectasis is a collapse of the alveolus. So if we think about an alveolus, you've got about somewhere between 500 and 700 million alveoli in your lungs. And those alveoli have a tiny little cell inside the air sac. The single air sac is called an alveolus. And that little cell in there is called the great alveolar cell, or the type 2 pneumocyte. And it's got a few jobs, but one of its jobs is that it secretes that soapy residue on the inside of the alveolus called surfactant. When we have an inflammation or an infection, that surfactant stops being produced. The inside of the alveolus becomes sticky. That surfactant acts to reduce surface tension, so it can pop back open quite easily when you take a breath in. But if your alveolus becomes sticky and your alveolus gets filled up with exudate from, say, an inflammatory process or an infective process, that collapses. And when that alveolus collapses and sticks shut, well, that's called atelectasis. Lots of atelectasis. We'll call that pneumonia. You get that consolidation that diagnoses pneumonia. So the next A is aortic dissection. And aortic dissection is in the aorta, particularly the branch of the aorta as it goes up out of the heart. There's the arch, and then it comes down behind the heart, the descending portion of the aorta. Where that aorta sort of comes down behind the heart, it's relatively attached with a ligament that was at one point in time the remnant of the hole in your heart that you had when you were a fetus. That ligament is called the ligamentum arteriosum, and it's an area of weakness in the wall of the artery. Now remember, all arteries, like veins, have 3 layers. They've got the inside layer, they've got a muscle layer, and then there is an outer layer, which is thick and fibrous. The muscle layer is, as you would expect, really, really muscular. But that inside layer is fairly delicate. And if I had a weakening in the wall of my artery, particularly a big high pressure artery like my aorta, then as turbulent blood flow can sometimes crack that inside surface of the artery, and those 2 layers between the inner surface and the muscle wall, they can actually split or delaminate. And that's referred to as an aortic dissection. Now overall, this is going to make that artery really weak. If we don't keep the patient's blood pressure well and truly in control, if we don't pick up that aortic dissection early on in its progression, then potentially that aortic dissection can burst. And when they burst, sadly, this is often a fatal event. These patients won't survive to get to theatre to have that aortic dissection repaired. It's a massive amount of blood loss in that regard. So that's aortic dissection. The next A, the third A in our series of 5, is angina. Now, angina or angina pectoris it's a big concept. It's a small word, but a big concept. Ultimately, when we talk about somebody having an acute episode of acute coronary syndrome chest pain, and that chest pain is later diagnosed to be just a case of angina. So what does that mean? Angina fundamentally comes back to that inside muscle wall of the arteries, particularly in the case of angina pectoris. We're talking about the muscular walls of the coronary arteries. They're those arteries that crown the heart. Coronary means to crown. Coronary, coronation, coronial inquest, the crown, right? So those arteries that crown the heart, the coronary arteries, quite muscular. Should they spasm, they can cause narrowing of the lumen, reducing blood flow to the myocardium at a time where the myocardium might be demanding more oxygen. For example, we're doing some strenuous exercise. And so if this spontaneous spasm of those coronary arteries occurs, it's at that point that you would have a reduction in blood flow to that piece of the heart muscle that actually wants more oxygen at that moment in time. There's therefore a dissymmetry with the amount of oxygen demand versus the ability to have oxygen supply. And of course, the patient will experience an ache, a pain, a chest pain, an ischemic pain. That's referred to as angina. It would make sense, therefore, that if angina is not caused by a rupture of a plaque or a clot, then stopping the clotting and all of that process, like we do for a myocardial infarction, is not part of angina treatment initially. Initially, what we want to do is we want to relax that smooth muscle. And we do that by stimulating an enzyme called nitric oxide that is secreted from the inside of the walls of those arterial vessels that cause vasodilation or relaxation. We stimulate nitric oxide with a drug called anginine for angina. So anginine, GTN, glycerol trinitrate. Overseas, they tend to call it nitroglycerin, which sounds pretty explosive to me. It kind of is. That's another whole video. So that's angina. Relaxing the smooth muscle that is in a state of spasm, angina, helps to improve dilation and therefore oxygen delivery to the heart at a time that it needs it. Of course, resting the patient helps too. Okay, the fourth of our 5 is antibodies. Antibodies, also called immunoglobulins, are part of your immune system. With some exception, it's your B cells, a specialised family of lymphocytes, white blood cells called lymphocytes, the B cells, that produce these immunoglobulins, or commonly referred to as antibodies. They're they're a large Y-shaped protein that sticks to the outside surface antigens of pathogens and disease cells in your body. So if you've got a diseased cancerous cell, an antibody could be attached to that, and it tags it for destruction in the same way that maybe a ribbon around the trunk of a tree might tag that tree to be cut down in a forest. So it's not just cancer, of course. Any cells that are infected by viruses, they secrete a number of antigens that could demonstrate that they're in distress, and so they could be tagged by antibodies. Certain tissues in the body are tagged by antibodies for destruction. It's how your autoimmune system sometimes goes a little bit haywire and can cause injury to tissues, the autoimmune diseases. And of course, bacteria and fungi and parasites, the antigens on the outside of those can be attached to by these antibodies. So antibodies are, if you think of them as the best way to think of these, is like the pink ribbon that the forestier might put around the trunk of the trees. The B cells don't cut the trees down. That's the job of the killer T cells. They come along and wipe out all the trees. They're the lumberjacks in this story. But they don't know which tree to cut down. They're just looking for all of the trees that have antibodies attached to them. And it's B cells that do that. So antibodies are there as part of that immune system. And so that brings us to our 5th and our final A, and it's anisocoria. Anisocoria. Now, anisocoria is a great big long word. You're probably never going to use it. It's one of those words that you park in your memory for a trivia night. But anisocoria is unequal pupils. You've occasionally seen somebody that might have a pupil that's one size bigger or smaller than the other pupil. Whether or not they constrict to light is irrelevant. Anisocoria means unequal pupils. So if you saw somebody who had anisocoria, you could say that maybe one pupil's a size 3 and the other pupil's a size 4. About 25%, 20 to 25% of the population naturally has anisocoria at certain times through the day. Maybe it's not always present, but you probably know someone in your family or in your friend group that has anisocoria, and they have one pupil that's a little bit smaller than the other. Still responds to light, they can probably still see, or alternatively it may have been caused from a previous injury. So that's our 5. What did we cover? Atelectasis, aortic dissection, we did angina, we did antibodies, and we did anisocoria. Tomorrow it's going to be the B, and I want you to help me select them. So give me all of your B words and I'll do a little, I only need 5. Give it a crack. See you tomorrow. Okay, so that's our KYJ, knowing your jargon. KYJ? Yeah, knowing your jargon. The alphabet series.